Today, I'd like to share a few observations to give you a sense of how this virus is continuing to spread throughout the Americas. Recent data show that in some countries, COVID 19 is exacting a larger toll on young people more than we saw earlier in the pandemic. More than 500,000 children and adolescents in our region have been infected, and these numbers continue to rise. When we look back at the data over the last few months, we see that in the US, young people, especially those aged between 20 to 29 years, they had the highest incidence of infections of any age group. In fact, they represent more than 20% of new COVID 19 cases. Many of them are unaware that they're infected because they have mild or no symptoms. While many young people won't become ill or require an ICU bed, they are not immune to developing the serious effects of COVID 19. We also worry that as more of us venture outside, that cases will spread to other more vulnerable groups. This is particularly concerning for the elderly and those with pre-existing conditions like diabetes or hypertension, for whom a COVID diagnosis can be much more serious. So let me urge people of all ages to continue to wear masks, practice social distancing to protect themselves, and avoid exposing others. The good news is that rates of severe COVID illness have fallen across our region. Today, fewer people are being hospitalized and fewer require intensive care than before. This is due in part to our growing knowledge of this virus and how to manage critically ill patients. It is also credit to the work of governments across our region that acted quickly to expand laboratory networks, increase hospital beds, and hire and train healthcare workers. PAHO has been working with countries as they strengthen their health systems to meet the needs of this new pandemic. Over the last few months, we've held more than 160 training programs. We've delivered more than 17 million COVID PCR tests and millions more gloves, gowns, and masks to keep health workers safe. When hospitals are able to cope and manage patients, there are fewer deaths. These efforts have helped save thousands of lives and will continue to protect countless more. So once again, I wish to thank all healthcare workers everywhere for their dedication and commitment, especially as many of them have had to work under difficult conditions. Yet despite these efforts, too many people remain at risk, especially those with limited access to prevention and care. Time and again, we have seen how health emergencies expose and exacerbate inequalities across gender, income levels, and race. And indeed, we have new COVID data that puts these trends into sharper focus. Within the United States, which is home to more than 40% of new cases in our region, Black, Hispanic, and Native American populations are nearly 3 times as likely to contract COVID as their white counterparts. They are also nearly 5 times as likely to be hospitalized and twice as likely to die from the virus. In the Amazonian areas of Colombia and Brazil, indigenous people are 10 times more likely to contract COVID 19 than any other groups. We are also worried about migrant and refugee populations who may be increasingly exposed and at higher risk as they search for better opportunities during these challenging times. And that is why PAHO has been collecting information about COVID's effects on refugees and migrants to help countries adjust their responses. Early on, PAHO issued specific recommendations to care for these vulnerable groups in the age of COVID. And we've acted on them. We have provided support to national authorities in Ecuador, Costa Rica, Brazil, and Mexico to design strategies so migrant populations can continue to have access to the food, the healthcare, and mental health support that they need. Migration is part of our history in the Americas. We've always witnessed people moving across the continent in search of a better life. Yet, migrants remain especially vulnerable to this pandemic because they're often at the margins of our health system with limited access to care and social protection that may be available to others around them. Later this week, PAHO is signing a landmark agreement with the UN's International Organization for Migration, in which we commit to work together for the health and well being of our migrant populations. Our solidarity towards migrants is not only key for controlling transmissions and preventing unnecessary deaths due to COVID 19, but it is a core reflection of our shared belief that everyone has a right to health and that we must leave no one behind. Thank you. Over.
Muchas gracias, doctora Etienne. Comenzaremos ahora con la sección de preguntas y respuestas, las preguntas que recibimos por correo electrónico primero y luego pasaremos a las preguntas en vivo y del chat. Recuerden escribirnos a través del QIA e incluir su nombre y su medio de comunicación. La primera pregunta entonces nos llegó de Kumar Malhotra de la BBC. Dice, would it be true to say that some of the worst hit countries in the region have now passed the peak of infections as measured by daily new cases? Doctora Etienne?
Thank you for this question. It is true that while transmission remains high in some countries in the Americas, others appear to have passed the worst of this current wave of COVID 19. However, as we have seen in other parts of the world, reductions in peak transmission does not mean that we are out of the woods. Far from it. So long as we lack effective specific therapeutics or a vaccine that has been tested, approved, and widely rolled out, we remain vulnerable to COVID 19. And all the time that we are vulnerable, the only things keeping the virus at bay are the recommended public health measures, such as hand washing, cough etiquette, physical distancing, and the use of face masks. Once we begin to lift these measures while the virus is still in circulation, we will see new increases. The region of the Americas is a complex mosaic of age groups, cultures, ecosystems, and health systems that are better prepared to deal with a pandemic than others. And this is why it is vital that countries demonstrate leadership, particularly at the local level, to ensure that public health measures are implemented in the specific areas where they are needed the most, and that economic and social protection measures are also put in place so that people do not have to decide between their lives and their livelihoods. And as I mentioned before, we do understand the fatigue that people are beginning to feel regarding some of the public health measures. But the public does have such an important role to play in stopping transmission. And at the moment, these are the best tools that we have available to protect ourselves and our loved ones.
Thank you, Dr. Etienne. La siguiente pregunta vino de Julia Saimis, Cobb, de Reuters. Dice, are countries in the region reopening too early? Dr. Barbosa.
Thank you for the question. You know that we cannot talk about a similar situation in every country in Latin America, in the Caribbean, or in North America. We have a very different situations, as was highlighted by our director in her inaugural words. We have countries that are controlling the transmission. We are seeing in the last weeks some countries, many countries that are reducing the transmission, but they have still a very high level of transmission, so they cannot believe that the battle has already been won. They need to continue all the measures that they have already implemented. So to a safe reopening of the economy, it's very important to know the epidemiological situation, not only at the national level, but in every state, in every province, in every municipality. So the national authorities can make the best decision, what to open, what are the protocols that they need to implement in order to avoid another outbreaks, and to monitor the situation very carefully, because if they detect that the transmission is increasing again, they can go back and to adopt new measures to control the transmission. So it's very important to strengthen the information that will be the best basis for the decisions about what and when reopen. Thank you.
Gracias, doctor. La próxima pregunta llegó de Daniel Cancel de Bloomberg. Dice, are there any countries doing a good job tracing cases in Latin America? Dr. Alighieri.
Thanks a lot for this question. The contact tracing is not a standalone measures. It goes with strong surveillance, strong laboratory network. It is the continuum of early detection of cases and quarantine of contacts. Countries with strong existing public primary health care networks are better prepared for contact tracing. Also, pre-existing field epidemiology training programs with junior and senior epidemiologists is a plus. Contact tracing has been also largely used in the Americas for some diseases as measles. So there is an experience of using contact tracing, mainly related to the eliminations of measles. Contact tracing is much more efficient with good tools, recent tools as GoData. It's a software that is very helpful in visualizing and organizing the information. And GoData is operational since the beginning of the regional response to COVID, operational in more than 20 countries in this region. Yes, there are good examples of efficient use of contact tracing, mainly in the Caribbean, but also in other countries. The Bahamas has a task force for contact tracing. Jamaica has been very successful. Suriname has been successful, and also Cuba in the context of a primary health care. Excellent pilot experience in Guatemala that is going to be expanded to other departments of the country. And as part of a battery of interventions for larger countries with large superficie as Brazil, Colombia, Chile, Argentina, dealing with remote populations, but also complex settings as large suburbs. So this is the panorama of the contact tracing in the region of the Americas. Thank you.
Muchas gracias, doctor. La siguiente pregunta vino de Michael Clocks from Depictions Media in British Columbia, Canada. Dice, how do you determine when a wave of infections ends and a new wave begins? How important is it to determine waves for health officials? Dr. Espinal?
Um, Thank you very much, Michael, for this very important question. Now, more important that we are entering in the fall and winter is coming, there is not a mathematical exact prediction when determine a new wave, but there are signs that we can and indicators that we can look at. And first of all, historically, when we look at history, H1N1 in 2009, and also the flu pandemic in 1918, they all started with a wave in the spring and then a second wave in the fall. So, and today we're seeing a second wave in Europe. Several countries are experiencing a second wave. It is important to differentiate between the peak of a wave and the wave itself. The best system to detect a second wave, it's a combination of indicators. First, have a strong surveillance system and a mechanism to test, trace, and isolate. The surveillance system is vital. Why? Because not only national, but more importantly at the administrative levels, cities, provinces, counties, and so on, because that will allow us, if we offer the testing to the population widely, that will allow the national authorities to detect incipient outbreaks. So that will come after, if the curve has been flattened. So test, trace, and isolation. The other issue is to keep the positivity rate ideally below 5%, and the curve, if we're looking at the curve and it's flattening after the peak, then, and if we have a sustained positivity rate of the testing in the last few weeks, we can say that a good control system is in place, and probably that wave is being controlled. But certainly to avoid a second wave would be to have a strong system of detection, isolation, identification of contacts to ensure we prevent those. And finally, not only when to say the second wave, but also what to do. And the best way to avoid the second wave is to continue doing the non-pharmaceutical measures. We recognize there is fatigue, but basic hygiene, avoiding crowded places, and social distance are key issues to avoid a second wave, which inevitably is happening. And not until we have a vaccine could we potentially rule out second wave for not even 100%, but with some degree of certainty when the vaccine is rolled out and so on, provided they are efficacious. Over. Thank you.
Gracias, doctor. Tenemos dos preguntas vinculadas con periodistas en Venezuela y sobre la vacuna rusa. Vienen de Nicole Shapur de Bloomberg y de Mariana de Barros de TV Venezuela. Nicole pregunta, Venezuela announced that recently received around 3,000 units of the Russian COVID-19 vaccine, currently in phase 3 of trials to be tested in Venezuela. Is PAHO aware of this trial and its details? Is it overseeing its applications in any way? Y Mariana de Barros de TV Venezuela también pregunta, dice que la vacuna rusa que llegó a Venezuela pasó la fase de precalificación. Pregunta si la vacuna rusa pasó la fase de precalificación de la OMS y también qué opinión sobre que Venezuela sea el primer país donde se pruebe la fase 3 de esta vacuna tiene la OPS. Doctor Ugarte.
Muchas gracias, Sebastián. Contestaré la primera pregunta en inglés. PAHO was not aware or consulted regarding the planned trial of this vaccine, of the Russian COVID-19 vaccine. Hence, PAHO is not involved into the application of the trial. So currently, we know of this trial from the news. So we are in that level. Respecto a la pregunta de la precalificación, quisiera mencionar que no hay vacuna precalificada por el momento. La OMS está recolectando la información científica y la información de todas las autoridades regulatorias de los países en los cuales se están desarrollando las fases y los ensayos clínicos de la fase 3. Y respecto a esta vacuna, Rusia publicó los datos de la fase 1 y 2. Los países que están en negociación, en contacto con las farmacéuticas que desarrollan la vacuna, hacen acuerdos bilaterales, en algunos casos con la participación de otros actores para hacer las pruebas. Y varios países están haciendo pruebas de varias vacunas al mismo tiempo. Gracias.
Muchas gracias, doctor. Me gustaría ahora darle la palabra a Gisela Salomón de la agencia de noticias AP para que pueda hacer su pregunta. Gisela, si nos escuchas, tienes la palabra.
Hola, buenos días. Quería focalizar la pregunta en Argentina. Argentina se ha convertido en uno de los países del mundo con más contagios, sobrepasando incluso a México en los últimos días. Y los casos se han disparado y expandido también al interior del país, a pesar de que fue uno de los primeros que puso una estricta cuarentena. ¿A qué se debe este aumento de los casos? ¿Por qué la tasa de positividad es tan elevada? ¿En qué fallaron? ¿Qué deben hacer? ¿Hay algo que el gobierno o que las autoridades epidemiológicas no proyectaron, no preveyeron? ¿Alguna falla logística o de planeamiento?
Gracias, Gisela. En el mismo sentido, solo quería agregar que también pregunta Joao Paulo Charleux de Nexo Journal. Doctor Espinal, ¿usted podría tomar esta pregunta?
Sí, muchas gracias, Gisela, por la pregunta y la pregunta del colega. Argentina definitivamente tomó buenas medidas, fue de los primeros países, como muy bien dices, en implementar medidas, en implementar cuarentenas, y tomó medidas también en beneficio de la población, sin banderías de tipo político, porque se convocó a todos los gobernadores, se convocó a la sociedad civil, a las sociedades especializadas para asesorar y debemos felicitar al ministro de Salud por dichas acciones. Sin embargo, es importante tener en cuenta que, como hemos dicho varias veces, este es un virus que es impredecible, no tenemos un año calendario, aprendemos más todos los días del virus. Argentina rápidamente aumentó el número de camas a nivel de hospitales y de cuidados intensivos, empezó sus campañas educativas también con tiempo. Quizás un poco lo más difícil para Argentina fue el sistema de rastreo de contactos, que se hace un poco más difícil, principalmente en el Gran Buenos Aires, y quizás ahí puede mejorarse eso. Pero definitivamente no es cuestión de comparaciones ni de si lo hizo mal o bien. Argentina está haciendo todo lo posible por esto, pero no tenemos dudas de que va a llegar un momento en que la curva va a ser aplanada si continuamos aplicando las medidas que se recomiendan. Y para eso el gobierno argentino está trabajando con nuestra oficina en Buenos Aires y con la organización desde Washington, y no tenemos dudas de que va a llegar, pero quizás un poco pudiera decir que lo que pudo haberse mejorado, el sistema de trace o de contacto de contactos de casos positivos para aislarlos más rápidamente, pudo haber sido, pero definitivamente Argentina ha tomado buenas medidas y el virus sigue su curso natural y su historia natural, y no hay duda de que en algún momento esta curva debe empezar a aplanar. Gracias.
Muchas gracias, doctor. Quisiera ahora también darle la palabra para que haga su pregunta Isabela González, del diario Reforma de México. Isabela.
Hola, buenos días. Yo quisiera preguntar, primero que nada, que antier México anunció una nueva metodología para contar los contagios y las muertes por COVID-19. En la nueva metodología cuentan las muertes y los contagios por asociación sin necesidad de la prueba, solamente que hayas estado en contacto, o sea, que tengan los mismos síntomas y hayas estado en contacto con alguien que dio positivo a COVID-19. Mi pregunta es si esto hubiera sido importante que se conociera por la población desde un principio.
Gracias, Isabela. Doctor Barbosa, ¿podría contestar?
Gracias por la pregunta, Isabela. Mira, México ha adotado ahora una nueva metodología que es más sensible para detectar los casos. Esa es una estrategia que se utiliza en muchas enfermedades, no solamente los casos confirmados por laboratorio, pero cuando la transmisión es muy intensa y el acceso a los testes de laboratorio es limitado, se puede utilizar essa estratégia de confirmar os casos por lo que chamamos de características clínicas, ou seja, uma pessoa que desarrolla um quadro clínico que é com os síntomas da COVID-19 ou de outra enfermidade e por associação epidemiológica, ou seja, uma pessoa que teve contato com outros casos. Isso vai brindar a México, eu creio, uma informação mais precisa sobre o número de casos e de defunções. Então, é importante para ampliar o conhecimento da situação. Também é importante, a OPS está trabalhando com as autoridades de México para ampliar a capacidade de testes. A capacidade de testeo é muito importante, porque tanto para conhecer a tendência do que passa no país, saber o número de casos, o número de defunções, não é somente uma estatística, mas serve para monitorear como está a tendência, serve também para indicar medidas específicas. Por exemplo, se uma pessoa tem um teste positivo, você pode recomendar, informar as medidas de isolamento, pode monitorear seus contatos. Então, as duas coisas são importantes. Esse esforço que o México está fazendo para ter um sistema mais sensível de detecção de casos e defunções e também o esforço para ampliar a capacidade de testeo.
Muchas gracias, doctor. Ahora también me gustaría darle la palabra a Lidia López, periodista del diario La Prensa de Nicaragua. Lidia, tienes el piso si nos estás escuchando. Lidia, no sé si nos estás escuchando para hacer tu pregunta. Ok, si no, yo puedo dar la pregunta que nos mandó Lidia. La pregunta de Lidia dice, hay una tendencia en Nicaragua. Esto significa que la población está adaptándose a vivir con el virus, es decir, la gente muestra haber aprendido a protegerse o ha asumido como nueva rutina la protección. Y dice, ante el relajamiento de medidas de protección y actividades públicas en Nicaragua, médicos han advertido sobre un posible rebrote del virus en las próximas semanas, pero según datos del Ministerio de Salud, la tendencia es a la baja. ¿Cómo se podría interpretar eso? ¿Ya pasó el peligro o se trata más bien de periodos más largos de incubación o tiene que ver con poblaciones asintomáticas? Doctor Ugarte.
Gracias, Sebastián, y gracias por leer la pregunta de Nicaragua. Voy a responder en las líneas que mencionó la doctora Etienne en sus comentarios iniciales. Estamos en un periodo de transmisión del COVID, de la COVID-19, y que va a estar con nosotros durante muchos meses más. Es necesario tomar las precauciones en todo momento. Esas precauciones tienen que ser tomadas con mayor precisión en los momentos en que aparentemente no hay mayor transmisión. Hemos visto experiencias de muchos países y muchas zonas en las cuales luego de muchísimo esfuerzo de las personas, del sector salud y de los otros sectores se ha logrado disminuir la tendencia y la transmisión, y como han dicho mis colegas, el doctor Espinal, el doctor Arbosa, el doctor Aldilleri, se ha bajado, se ha aplanado la curva, nos genera un optimismo de que ya estamos fuera del riesgo. La verdad es que cuando nos confiamos más, la transmisión se expande a mayor velocidad. Es por eso que cuando existen reportes de reducción de la transmisión, debemos estar cautelosos de mantener esa situación, aunque eso sea una circunstancia que pueda cansarnos en el largo tiempo, pero sería peor ver unos rebrotes que incrementen el impacto en la población, incrementen el impacto económico y social y causen una gran cantidad de fallecidos. Hemos visto que cuando aparecen los brotes en muy corto plazo, el número de fallecidos aumenta significativamente por la sobrecarga en los servicios de salud. De tal manera que Nicaragua en particular y otros países que están viendo o que se reportan que hay menos cantidad de casos, deben implementar las medidas que se han mencionado anteriormente, es decir, la higiene de manos, el distanciamiento social o físico y el uso de mascarillas. Y por supuesto, apenas aparecen los síntomas, aislarse y buscar atención médica e informar a las personas con las cuales uno estuvo en contacto para que tomen sus precauciones. Es una responsabilidad de todos y esperemos que así podamos reducir el impacto de la COVID-19. Gracias.
Gracias, doctor. La siguiente pregunta es de Erika Cabal Martínez, de G Radio Internacional. Dice, ¿en qué van las investigaciones y ensayos clínicos con relación a tratamientos sin vacuna para SARS-CoV-2? Doctor Aldilleri.
Gracias para esa pregunta sobre investigaciones. En este momento, lo más importante de destacar es de cumplir con el estándar de atención y la inclusión en los protocolos de tratamiento de algunos medicamentos comprobados, tal como la dexametasona, que ha sido demostrada como eficiente en reducir la mortalidad en pacientes bajo oxígeno. Hay bastantes estudios en camino. Quisiera destacar uno especialmente, es el ensayo Solidaridad, Solidarity en inglés, que es el proyecto más importante coordinado por la OMS a nivel mundial para probar nuevas terapéuticas. En las Américas, países como Argentina, Brasil, Colombia, Honduras, Perú y otros ya han movilizado en pacientes en los diferentes brazos del estudio Solidaridad. A nivel mundial, más de 12.000 pacientes en 30 países han sido incluidos y eso ya ha permitido la actualización de varias guías de manejo clínico. Los brazos activos del ensayo Solidaridad, algunos han sido eliminados del ensayo, tal como la cloroquina, hidroxicloroquina ha sido eliminado de la investigación, comparan el estándar de atención solo con el estándar de atención más una otra intervención, otro medicamento. En este momento están en el estudio Solidaridad medicamentos tal como Remdesivir, bien conocidos, que hemos comentado varias veces en este foro, Acalabrutinib y interferón beta 1A. Estamos progresando cada día en el conocimiento de la enfermedad y los datos se están procesando con toda esa red mundial y regional que acabo de describir. Muchas gracias.
Gracias, doctor. Tenemos varias consultas sobre escuelas. La primera es de Juan Manuel Nievas, de la agencia de noticias Xinhua de China, y dice que los alumnos de Argentina están sin clases presenciales desde marzo pasado y no hay definiciones en torno a un regreso presencial a las aulas. ¿Qué impacto tiene eso para los estudiantes? ¿Qué condiciones, según la OPS, deberían darse para un regreso seguro a las clases presenciales? ¿Y cómo imaginamos esa nueva normalidad para la educación? Por otro lado, tenemos de Alia Brinks de CBC Barbados, que también pregunta con respecto al tema de educación, pero ella dice si, en el caso de Barbados, si la OPS cree que el gobierno... déjeme leerla en inglés, porque es en inglés su pregunta. Dice, Barbados recently recorded 2 cases of COVID-19 in one of its secondary schools. Although Barbados government has been commended for its ability to control the spread of the virus, do you think the government missed the mark by reopening schools? That's the question from Alia Briggs from CBC Barbados. Doctor Espinal, ¿usted podría tomar estas preguntas?
Sí, muchas gracias. Muchas gracias. La primera pregunta en español, luego la segunda en inglés. Argentina, la verdad que está todavía pasando por un proceso epidémico muy fuerte. Entonces, es importante que esto debe ser tomado en cuenta. Ahora bien, con relación a las escuelas deben cerrarse si no hay otra alternativa. Tan temprano como en marzo, la Organización Mundial de la Salud y la OPS han sacado recomendaciones y tips para qué hacer en las escuelas. Y más reciente, en septiembre, el mes pasado, junto a UNICEF, se han sacado ya guías donde se recomienda que la reapertura o el cierre de escuelas debe ser basado en un análisis de riesgo en el nivel local, en la comunidad, porque puede ser que en todo un país no haya necesidad de cerrar las escuelas si no hay una intensa transmisión comunitaria. Y hay varias categorías y estas guías están disponibles en los sitios web para los gobiernos. Por ejemplo, intensa transmisión comunitaria, las escuelas deberían permanecer cerradas para evitar que nuestros niños sean infectados y, si es posible, realizar la educación en distancia a través de medios virtuales. Pero reconocemos que los medios virtuales no llegan a todas nuestras comunidades. Entonces, lo importante es ese análisis de riesgo para, si podemos reabrir algunas escuelas donde haya transmisión no comunitaria y en conglomerados fuertes, entonces sí las escuelas pueden ser abiertas con las recomendaciones específicas, porque hay recomendaciones específicas como el mantener el distanciamiento social, aumentar los espacios dentro de las escuelas, aumentar la ventilación y todo esto. En fin, el caso de Argentina, tan pronto esta curva, las autoridades, estamos seguros, van a reevaluar la situación. Pero, como muy bien digo, no necesariamente en todas las comunidades quizás deban estar las escuelas cerradas en países grandes y federales. With relation to the Barbados question, no, there is no need to, and we don't think Barbados missed the boat by 2 or 3 cases in schools. One of the recommendations, if there is only 1 or 2 cases or very low digit, in very low numbers, the schools can be maintained open, and because education is really critical for the children. As long as we implement the measures on social distance, non-pharmaceutical measures, education, parents' education, engagement with the teachers also, include also, for instance, the issue of COVID in the curriculum to educate the children. The schools can be maintained open, except if there is, and there are clear recommendations based on categories, as I mentioned in Spanish, based on cluster transmission, community transmission, or no transmission, and so on. The important thing is to watch and monitor how the epidemic evolves. But if there is no increased sustained transmission, there is no need to close schools. It should be the last resort. Thank you. Over.
Muchas gracias, doctor. La siguiente pregunta llegó de Ariel Alberto Jara Acosta, periodista en Canal 19, TV Aire de Coronel Oviedo en Paraguay. Pregunta si hay un tiempo estimado para el levantamiento de la pandemia. Doctor Barbosa.
Gracias. Desafortunadamente, la respuesta es no. Todavía no tenemos como estabelecer em quantos meses a pandemia vai estar completamente controlada. Recuerde que uma pandemia é quando temos a propagação mundial de uma nova enfermidade. Essa é a situação atual que temos hasta hoje do COVID-19. A transmissão é distinta. Recuerdem que isso começou em China, depois tivemos alguns países em Europa, Itália, França, Espanha, que foram muito afetados. Depois se moveu para Estados Unidos, depois América Latina, mais recentemente Índia, está com uma transmissão muito forte, em África do Sul, ou seja, o vírus todavia se está a mover em todas as partes. Então, exatamente por isso, é muito importante manter as medidas de vigilância, de resposta, manter todas as medidas que os governos han adotado para monitorear a situação e, quando identificam que a transmissão está crescendo, adotar as medidas para reduzir a transmissão, as medidas de distanciamento social. E também é um chamado para as comunidades, para as famílias, para as pessoas. Temos algumas medidas que são muito efetivas para reduzir a transmissão. O uso de mascarilhas, de cobre-bocas, manter a distância física de 1,5 metro quando é possível, sair só para as atividades essenciais, lavado de las manos, ou seja, há muitas medidas que se podem adotar em nível individual, familiar, em las comunidades, para reduzir a transmissão, hasta que se tenha o controle completo de la transmissão em nível mundial. Gracias.
Gracias, doctor. La siguiente pregunta es de Jennifer Reddock, de Montserrat Reporter. I would like to give Jennifer the floor to ask her question. Jennifer, if you are listening, you can do your question. No, it's not.
Hi.
Hi. Yes, we can listen.
You can hear me, okay?
Yes.
My question is related to a comment that the director mentioned, Dr. Etienne mentioned earlier. She talked about the reality of migration. And we know that at this time, we've seen the many migrants are returning home for holidays around Christmas time, and although lockdown measures have eased in many cities in North America and Europe, we're now seeing a rise in COVID-19 cases. Some airlines have resumed flights to Latin America and Caribbean destinations. My question, I have two questions. Would you encourage people in North America and Europe to proceed with holiday travel plans to visit relatives and friends back home in other parts of the region? And two, what is your advice to member states in the Caribbean which have traditionally engaged in end of year's national cultural festivities? Should they proceed with these plans?
Gracias, Jennifer. Doctor Ugarte, ¿podría tomar esta pregunta?
Okay, thank you, Sebastián. Thank you, Jennifer, for this very important question. I would like to emphasize that the risk of transmission is still high in several areas of the Americas, Europe and other regions. A decision to travel should be taken based on each individual context and risk analysis. So people that live in areas with no high transmission, I mean with low transmission, and without movement restrictions, and people that are not in isolation and quarantine and are healthy may plan their travel. But prospective travelers that live in areas where community-wide transmission and movement restrictions are in place should reconsider their travels to a later moment. Persons who are in isolation or are quarantined or get sick at the moment of travel should cancel their travels. Under all circumstances, people that travel must adhere to hand hygiene, use of masks, and physical distancing while on journey, but also at the destination. This is extremely important. And also they should monitor their health at their destination. Of course, if they develop any symptom or they get sick at their destination, must self-isolate and seek medical care immediately. That way, the persons who get sick during the travel on the journey or at their destination will contribute to reduce the transmission. And although these recommendations are applicable to everybody, people who travel and visit their relatives may enjoy visiting their relatives and also the festivities if they apply these recommendations. These recommendations have been also put forward in a document that PAHO just published a few days ago. And we've been in close contact with many countries, particularly in the Caribbean, regarding the reopening of non-essential international travel. So enhancing surveillance, enhancing contact tracing, enhancing the capacity of laboratories to test, and also on the clear information for the travelers and their own population is something that the countries are implementing and are enforcing. And I think when everybody takes this responsibility of taking the protective measures, we will be better along because we will be in this situation for several months to go. Thank you.
Muchas gracias, doctor. Ya estamos llegando al final casi de esta sesión. Última pregunta para la doctora Etienne. Dice, many places have been implementing social distancing measures since March, and there is growing fatigue about these measures. What advice does PAHO have for people in the region? Doctora Etienne.
So thank you for this question. As you heard from the other panelists, when the first outbreaks of COVID-19 were identified in our region, many countries were quick to react. Cities came to a standstill, schools and offices were closed, events canceled, planes grounded. And this was painful and unprecedented. But let us remember, it saved countless lives and bought us time to prepare our health systems. Since then, we have seen cases go up and we have fought to bring them down in many areas of our region. And in this process, we've learned more about how this virus is transmitted and how to better prevent its spread. This includes new ways to minimize risk, from wearing masks and sanitizing public spaces to developing new ways to meet, to learn, and to work remotely. All of us have adapted, and there have been many innovations to enable us to better face this new reality, including both within our health systems, but also in our own personal lives. However, this is not the time to let our guard down. Transmission is still very high in our region, and too many of us are vulnerable. While the pandemic continues, we can at least rest assured that research is taking place, as you heard earlier. Research that will provide us with new leads on how to reduce transmission, to improve testing, improve treatment, and eventually to develop a vaccine. So let's remember the current situation will not last forever. But in the meantime, while it is true that most of us are growing tired of the restrictions imposed as a result of this virus, and we understand, I am confident, however, in our ability to continue to be resilient and innovative, and on a personal level, to find new ways to live our lives while navigating the new normal. So stay put with the well known and proven public health measures. Thank you so much.
Muchas gracias, doctora Etienne. Muchas gracias a todos por participar en esta sesión. En breve, como siempre, les estaremos enviando las palabras de apertura de la doctora Etienne, así como la grabación de la sesión. Y recuerden, como les mencionamos, que este viernes a las 11 de la mañana de Washington los invitamos también a cubrir la firma del acuerdo entre la OPS y la OIM sobre migración y salud. Van a estar recibiendo más información de nosotros sobre ese evento también. Así que muchas gracias por participar en la sesión de hoy y que tengan todos un muy buen día. Saludos.